fall semester. So officially, I am a second year student. It is early. Been up since 4:30. I do have an exam for perio. First day back on everything we pretty much learned throughout the two perio classes I've taken. And then I do have a quiz for scientific literature. I have a total of 8 classes this semester. So I have scientific literature, dental hygiene principles for perio 3, pain and anxiety management, the lab for that, clinic, there's more, I can't remember, but radiology. There's one more. Hang on. Oh, and the advanced perio clinic, which we're going to be treating a heavily involved periodontal patient. I still yet to have found my perio patient. So the first 2 weeks of school are going to be dedicated to trying to find the patient. We were unable to find the patient last semester, but we'll see how it goes. So ahorita I'm just going to go to school. I'm going to study for this exam and quiz. Should be alright. See how it goes. So we'll see you guys al ratito. So, I am out of class. It is pouring outside, but ahí vamos. Test was okay. I could have done better, but we're tested a lot of like on evidence-based stuff. Like there's clinical evidence suggesting that this, and this in terms of perio. Well, it wasn't in the book, but I ended up getting a B. It's okay. It's an okay start. And then for that quiz, we ended up having the lecture first and then getting quizzed on it. So it's for scientific literature. So we were learning about forming questions so that we could do like computerized research. And there was something called like a PICO question, and I forgot what the I stood for, and that was one of the questions. I'm like, that's such an easy thing to get a point for, and I missed it because I couldn't remember what it was. Don't ask me what it is. I still don't remember what it is. I looked it up afterwards y ya se me olvidó. Pero now I'm gonna go home. I'm gonna work on my assignments for next week, starting the readings, taking notes, and then that will be it. So I will see you guys mañana. Morning. It is Tuesday, day 2. Okay, so let me run down the plan for today. So today I have class from 10:30 to 12, and it's for radiology 4, but it's mostly for like if you take radiographs during clinic, then you can have them assessed by the professor. We do a little bit of lecture, but it's not as heavy as it was like in the fall, the first fall semester. But today we're going in to screen a patient for perio, me and my perio partner. We didn't have anybody scheduled originally, but we found somebody like at 8 p.m. So we're bringing them in because we only have this week and next week to find somebody. If not, we're in trouble. So I will see you guys once I get out of class. So I just got out of class. So we had no luck this morning with the screening patient, but that's okay. They didn't qualify for perio, but we're gonna keep trying. And then radiology was fine. It was a lot of like introductory stuff, like the kind of requirements that we need. So this semester we need 2 CIS, which is 2 full FMX, 2 panels, and bite wings. So these are gonna be done with the sensors this time. Last time we had option of PSP or sensors, but it'll be all sensors this time. And this semester we're gonna be learning how to use those handheld X-ray machines. What are they called? I have to get back to you. I don't remember what they're called, but we're gonna be using the handheld X-ray machines this semester. That's what we're gonna be learning. And then I lost my patient for the afternoon tomorrow, but I was able to find a replacement. So that's what I did for the majority of the rest of the time, because we got out at 12. So I think almost 4 o'clock now, but I'll go home, I'll finish my perio reading. I'm gonna study for the quiz I have on Friday. Normally I don't have class on Friday, but it'll be on pain management. It's like a pain management lab quiz. So I'll study for that and then call it a day. Bye. It is Wednesday, so today I will be having clinic all day. First half I'll have screening duty, which is when we screen patients that want to come into the school. We'll give them a categorize them so that they go to the right student. little time to get it done. So now I really have to like pick up the speed. And then in the afternoon, I have my first patient that comes from my recall list. So we'll see how that goes. A little nervous because the grading is very different, it's a little different, but we'll see how it goes. Todo en la manos de Dios. So I'll see you guys once I get out. I just got out of clinic. I ended up not having any screening patients in the morning. They all canceled. It's okay. I did have my patient in the afternoon, and I will say I'm slowly getting better. By that I mean, for the first time, I did not get any points taken off for the gingival description. Now we just gotta work on the extraoral, intraoral exam. But it's starting off good. Tomorrow we are screening another patient for perio to see if they qualify. We will see. But I'm just gonna go home, try to finish the reading for perio, and study for the quiz on Friday. That's on like anesthetics, the different types of like syringes and whatnot. And that's it. So I'll see you guys mañana. Morning. So today is Thursday, and we found another patient last night to screen. I was trying to do their medical and dental history for like till like 11. So right now what I'm gonna do is look up their medications, because I was so tired I didn't want to do it last night. But I'm gonna look up their medication using this book, and then I just gotta go in, set up the bay, transfer all the information into the computer, and then we'll be all set. Then afterwards we're gonna have lab, perio lab. We'll see how that goes. Hopefully all goes well, but I will see you guys once I get out of class. So I just got out of school in the morning. Again, no luck with the perio patient, but that's okay. In the afternoon we just had class from 3:30 to 5. It went past 5 because we didn't start right away, but it was just basically going over what was expected, what was going to be expected during the perio program. But all went well. We have a lot of research that we have to do to come up with the treatment plan. It's going to be a little bit overwhelming, but doable. So we're just gonna go ahead and head home, study for the quiz of tomorrow on the syringes and local anesthetics. And in the morning I'm gonna have an IPE thing where it's like a intercultural professional something like a what is it called, interprofessional collaboration, something where like different health career programs are gonna get together and we do like little activities. But that'll be tomorrow from 8 to 11, I think. Then we have a 2-hour gap or so, and then we start perio lab from 1 to 6. So I will see you guys mañana. Morning. It is week 2, Monday. So we're here at school early. We ended up getting some Panera. We don't know anything about coffee, but we're gonna try it out today. Jerusalén got a cappuccino. I got, I think, like something vanilla latte and a caramel one. Some breakfast sandwiches. And this morning I have 4 quizzes for all the classes. One of the classes got switched to Friday. That one has a quiz as well. No tests this week. Then in the morning we're gonna be in the sim lab to go over the area specific curettes. So we're gonna have to bring all of our advanced instruments today. Very exciting. What else? I think that's it. So I'll see you guys once I get out of class. Por mientras, I'm just going to be reviewing for quizzes. Good afternoon. It's the end of the day. All the quizzes went well. I got 100% on each and every single one. Thank the Lord. I was praying. I was like, Diosito, I'm like, what should I put for this question? So he helped me answer all my questions. Very good. So now I think we're gonna get some ice cream. Get some ice cream, and then call it a day. My brain is very tired. We had class from 8 all the way until 4:30. Classes all the way from 8 to 4:30, and then I was trying to call patients to try to fill up the schedule. So we'll see how that goes. I still have to try to find somebody for Wednesday in the afternoon. A little scary because today is Monday, tomorrow's Tuesday, so we'll see. But I'm going to keep trying, see what happens. We'll see you guys tomorrow. morning. It is Tuesday, so I'm on my way to school. It's 6 something. We found 2 more patients to screen for perio. Hopefully, they show up and they qualify. This is kind of like our last week to really find somebody, because starting next week Thursday we're supposed to be bringing in the perio patients to actually start collecting their assessment data and working on the treatment plans. So todo en las manos de Dios, that everything works out. Hopefully it all goes well. And so this semester I'm making more of an effort that the next day I review everything that I've learned and edit my notes to add like the stuff from lecture to compare it to the stuff from the textbook. So that is my goal. I feel like it's been working so far, because the quiz that was for this week on scientific literature kind of built off of what was from the first week, and I had been reviewing it maybe once or twice, and I kind of remembered what they were about, which made it easier to keep learning the new stuff. So I think I'm going to continue that as much as I can. The road is so bumpy today. But I will see you guys once I get out of class. It's Wednesday. I'm so tired. I didn't get a chance to record, but the 2 patients that we screened yesterday didn't qualify for perio, but that's okay. And then so today I have just my regular clinic. I have my 2 patients coming in, one in the morning, one in the afternoon. So I'll probably be here from 7 to 7, and then we went out yesterday again to try to market some more patients. No luck so far. We went to a couple of nursing homes and the library, but I don't know. And then we were supposed to have found the patient by tomorrow, but here we are. I'm kind of stressed about it. All in God's hands, but I'll see you guys once I get out of clinic. Good morning. It's Thursday. I'm tired. I have a patient in the morning that I want to finish. Hopefully I will get to it. We'll see. But in the afternoon, I think we're gonna be doing the slimline on each other. We have another practice session that we can do. So that's what we're gonna be doing in the afternoon for perio lab. So hopefully all goes well. Morning. We found a perio patient. Well, it was somebody that was screened at the school clinic, and they ended up calling for perio. And since my group was the last one that didn't have a patient, it was given to us. So it all worked out. So next week, Thursday, they will be coming in, and we can get started. So the goal is to get started with the treatment plan that we have to do. It's a lot of research that we have to do. So everything that we want to do with this patient, we have to find evidence with taking the vitals, self-care. Why are we recommending this technique? And then we have to find scientific evidence to show that this technique is going to help them with this, and this. It's a lot, even down to instrument selection. But that we're not going to stress. But today I have class from 1 to 6. It's about 10 o'clock. I'm going to school early to study for that quiz, because I've been screening every day and I haven't had time to do anything. But that is the plan. And what else? So the lab we have in the afternoon is the pain management lab. So we're just gonna be finishing up on the different techniques as to what the different anesthetics on the different injection sites, what needle you use, where all the technique basically. So that'll be the plan. I think last time, I don't know if I mentioned it, but last week Friday we were practicing on peaches, giving the little injections. That was fun, but my hand was shaking when I was trying to aspirate, which is when you kind of pull the needle back, or the thumb ring, to see if you hit a blood vessel. But anyways, going to school, going to study. I'll see you once I get out. Here is said practice session with the peaches. Good morning. It's week 3. I forgot to record, but today's Wednesday. My patient that was supposed to come in the morning ended up canceling, but I did find somebody to fill it in. Right now I'm having my little breakfast burrito. But treatment plan is coming along. It's due tomorrow. We still have like 3 different topics to research. So I think we're gonna pull an all-nighter because we're gonna be in clinic from like 7 to like almost 7. We'll see what we can do to get it done, but we'll be all right. So I'll see you guys once I get out of class. Morning. It is Thursday. Yesterday for clinic, it went pretty well. I passed my patient. I did pretty well. I only ended up missing like I think 1 little piece of calculus, and it was like in a pocket that was like I think 9 millimeters, and it was my first time going in that deep into the pocket, so it was a good learning experience. But I was proud of myself for getting like the distal of the molars, because that was the area I was struggling with last semester. But now we pulled almost an all-nighter. We were up until like 4 a.m. trying to get this treatment plan done. It's due before 1:30 today, and we still haven't finished. We need to just cite our sources and check all the grammar, do like the little finishing touches, and we should be all right. But it's like about 9 a.m. We're gonna go finish that up and then go take a nap on the hammocks outside. I think that's it. Well, I'll see you guys once I get out of perio clinic. We'll be seeing our perio patient for the first time today. I'll let you know how it goes. Hasta el rato. Okay, I'm in school, and I forgot to tell you, but yesterday, once we got out of the school, quizzes were okay, but we did the anesthetic lab. That was fine. My whole like lip on this side was numb. We did the PSA, MSA, ASA, and the IO on the right side. Imagine we're doing the other side next time. I don't know. But I'm here at school trying to get my stuff done, work on this treatment plan and a project for scientific literature. It's a lot to get done, but it'll get done. And I just need to engrave one of my instruments. This one's the Barnhard 5.6 rigid, so I'll just do that with the little engraver, and then we'll be all set. Good morning. It is Thursday. Yesterday's clinic went pretty well. I passed my 0, which is pretty good because they started doing this thing where they're saying we're now at a point where we can pass the zeros. We should be able to pass the 0 without any calculus remaining, and if there's like 1 piece, then we would fail the patient. But luckily I passed. Today I just have 1 new patient, and then I'm going to be having perio clinic in the afternoon. We pulled an all-nighter to get this treatment plan done. Now we're just gonna check the grammar, and then we'll be all set. So I'll see you guys. I forgot to record, but it is week 5. On Monday, we were supposed to turn in this presentation for scientific literature, where we appraised 2 articles. I had lasers and scaling and room planing, and then we're supposed to talk about like their methodology. This is like kind of how the study was done, and I had 2 systematic reviews with meta-analysis that I appraised, and then we were supposed to choose like which one we would keep as like the best one, and then explain why we didn't choose the other one, like the strengths and weaknesses. And that was honestly so stressful because I didn't know what I was talking about. And I think everybody was on the same boat, but I turned it in. I didn't end up presenting, thank the Lord. And then probably next week. And then yesterday we were learning about the GPAP and the EPAP, which is glycine air polishing and erythritol air polishing. We have to do a skill assessment where we do 2 quads with that. Same thing with the sodium bicarbonate and the aluminum trihydroxide, which is a little bit harder to find a patient like that, but we'll see. And then 26th. It is Monday. Haven't had time to record. It's been very busy. Lots of late nights. So I got to school early. I have 2 quizzes today. For perio, we have 3 chapters that we're being quizzed on. And for dental hygiene principles, we're being tested on the local antibiotics like the Arestin, for example. And then in the afternoon, also there's a possibility I might present that project. Still don't feel 100% comfortable with it, but at this point, it is what it is. So I would say that, well, we'll see. And then in the afternoon, we're doing local anesthetics again. We had done it like 2 weeks before. We did the PSA, MSA, ASA, and the IO. And I think this time we're going to do the IAN, lingual, mental, incisal, GP, and NP. From what they said, the GP and NP are the more painful ones because it's in your palate. But we'll see how that goes. But I'll let you guys go so we can get studying. I'll see you guys later. Morning. It's now Thursday. I'm so tired. I went to bed like at 3 a.m. to try to finish up that treatment plan. But yesterday was okay. I had screening duty in the morning. Only 1 patient came. Afternoon I had my own patient, my 3 sub. And it's not all that great, but it's okay. It's a learning process. But now in the morning I have 1 patient coming in. And in the afternoon we have our perio patient coming in again. So that will be fun. And then I have just to focus on exams and quizzes that are coming up next week. We'll see how that goes. But I will see you guys once I get out. Okay, week 7. I forgot to record, but it is Wednesday. Monday we had an exam and a quiz for perio. I did better on this quiz for perio exam. I mean, I passed it, but it wasn't good. Tuesday, I just worked on my recall list, calling the patients, trying to get them in. And today, I have 2 skill assessments that I want to try and do. I'm gonna try and do my special needs skill assessment. So for that, we have to research a special need for our patient, and we have to like write down like what are the oral manifestations with this condition, what are the treatment modifications, things like that. And then the other skill assessment I want to do is the dentition charting. I had already done like 1 quad. We need 2 quads this semester, and the dentist only gave me 1 quad on the other patient that I did. So I had to find another patient to do another one. Hopefully this one gets accepted to do the dentition charting, because they have to have like a certain amount of like things going on in their mouth to qualify for that skill assessment. But I'll let you guys know how it goes when I get out. I'll see you guys. Good morning. It is week 8. We have our final for scientific literature, a quiz for perio and a quiz for principles on implants, and let's see the other quiz on something else. And then we're going to do nitrous today. We're going to do nitrous today in lab, which is pretty exciting. So I just have to review that PowerPoint and I'll be all set. I ended up getting some Panera this morning. But I'm gonna go inside and then start studying for these quizzes and this final exam. See how it goes. Well, all in God's hands. I pray that all goes well. I think it will go well. I ended up doing pretty good on that presentation too. I only got 1 point taken off. I got a 15 out of 16, which is pretty good considering that thing was weighed 55% of the grade. But it all went well. Worth the stress, but I'll see you guys once I get out. I just got out of clinic. It's Thursday. Ended up finishing one of my patients, so 1. So I've completed 2 ones. I just need 2 more. I should be able to complete another one next week, and in my 3 sub next week as well. It's already midterms, but we're making steady progress. And then today I had the perio clinic, which was pretty fun. We're making slow but steady progress. It's new experience trying to learn all the different fulcrums, the assisted fulcrums. It's pretty fun. But right now I need to go home, finish my midterm reflections, turn that in, and start studying for perio exam that I have next week, and a whole bunch of quizzes. So I'll see you guys mañana. Morning. It is, I think, like week 9, and today we have an exam for perio and a quiz for pain and lab management. But I wanted to show you this. Look, isn't that so nice? Brought to you by Jesus Christ. Anyways, okay, I'm gonna go back inside into the building and keep studying. Our class got moved until 10. Normally it's supposed to be around, ¿qué serían? 8:30. So it gives us plenty of time to study. Ahorita it's like around 7 o'clock. So I got 3 hours to get this going. I'll see you guys al rato. Okay, so today is, what day is? Friday. And then here, let me show you, we came to volunteer here as a homework assignment. Have everybody here. Day 2 of doing this, but a different location. This is how it's looking like. Busy day. Saw like 6 patients back to back. Pretty fun. But now we just gotta clean up and then go home and then do this again tomorrow at 6:30. Morning. It's like week 11. I haven't been doing a good job of recording, but kind of to recap, what I was showing you before, that was like a volunteering that we have to do for community class. But we don't have that class until next semester, but we got it done this semester, which is pretty nice. There was 3 days of that. There was the one on Friday was for kids, and then the Saturday and Sunday were for adults. It was crazy. There was not enough instruments, so we kept running out. The air polishing didn't work. The motor driven polish didn't work. We were taking turns because there was not enough chairs for each to have our own, which worked out pretty good. One was assisting, one was cleaning, and there was a lot of people because that event was free, but it kind of opened our eyes to just how good we have it at school with all those instruments and all that, everything. It was a wonderful experience. I would do it again. But what was I gonna say? This morning we have a midterm for pain management lab. That was pushed because it was supposed to be the weekend following the volunteering, but we were all wiped out, so they moved it, which is pretty nice. So I just have to study for that. I woke up late today, but here I am. And then after that we have 2 quizzes, one for perio, one for principal, so we'll see how that goes. But I will see you guys once I get out. Morning. It is week 12. I haven't been recording a lot because it's been a very busy semester, but this morning I have a quiz for principals. It's gonna cover like antimicrobials like Arrestin, implants, and endodontics. And then I have 2 quizzes on perio and for pain management. And then later I have to leave class today. Normally we have class from they moved it from 10, and then I would have to go back into the lab until like 8:30 p.m. But we're doing a periodontal observation today, so we're gonna go up. My partner and I are gonna go observe a crown lengthening procedure, and we have to do a project on this where we kind of talk about like what the procedure is, how it was done, like post-op instructions, things like that. So that should be a fun one, but we'll see how it goes today. I'm gonna head inside so I can get studying. It's about like 6:45. Class doesn't start until 10, but I do want to study for that, so we'll see how it goes. So I'll see you guys once I get out of class. Morning. It is Wednesday. Exam went well. I only missed 1 question. Quizzes were better. We were supposed to do that perio observation. Patient canceled, but luckily we were able to find another office. So we're gonna do now, instead of crown lengthening, we were able to book a gingival flap surgery for pocket depth reduction. So we'll see how that goes. But now I have to finish one of my patients in the morning and starting another patient in the afternoon to try to get my requirement done for dentition charting. We have to do 2 quads. I was able to do 1 quad towards the beginning of the semester, and I just have 1 more. But I will see you guys once I get out of class. Okay, good morning. So today's Thursday. Yesterday went well. I finished my patient with a good grade in the morning, started the other one in the afternoon, and then now I'm starting another new patient today in the morning. My mentee from the first year is going to come in and do a part of the assessment data, so like the dental history, health history, the extra oral exam, and then I'll take over and do intraoral forward. So that's going to be exciting. Hopefully all goes well and I'm able to move swiftly through the appointment, but we'll see how it goes. So I will see you guys once I get out. Oh, and then we also have an exam for our perio patient. So first part of the exam is going to be general perio questions, and the second part is going to be based off of the presentation that we did. So for the presentation, it was just like a case study of our patient. We're going to present it and then have our classmates guess like the staging and grading for perio. So we'll see you guys when we get out. Good morning. It is Monday. It's snowing. I think it's like week 13. But this morning I have a perio exam that I have to study for. I'm not doing as good in that class that I would hope. But I got here early to try to study as much as I can. And then I have another quiz on pain management, no, principles on lasers. So that'll be fun, but I'll see you guys once I get out of class. So today is, I think like week 13 or 14. I'm losing track, but this morning I have 2 patients. One I'm going to try to finish in the afternoon, we'll see. And then the other one is a kid patient, so I'll be able to get him done in 1 appointment. The observation yesterday went really well. Our appointment was at 9, but the patient wasn't comfortable with us being in there because she was so nervous. So we ended up waiting for another procedure at 11, which worked out pretty good. It was a gingival flap surgery, like all in the mandibular teeth. So essentially, like they cut the gums, peel them back, and then clean them, and then cut away all the granulomatous tissue or granulous tissue, one of the two. And then they sew them back up. They ended up putting like this putty around the teeth to kind of protect the teeth, which was pretty cool. So we have to work on our presentation for that, and then finish up our treatment plan revisions and get that turned in. But I will see you guys once I get out. Good morning. It is Thursday. I don't have clinic this morning, but I am coming into the opposite section to screen 2 people. Hopefully they qualify as a 2 and a 3, but we'll see. And then in the afternoon we have advanced perio clinic. We're done with our patient and everything. Now it's just doing presentation. So we made a presentation with like a case study of our patient. So we'll present that, and then we're supposed to try to guess the staging, the periodontal staging and grading. So that should be fun. But I'm gonna head inside so that I can enter all the medical and dental history for these 2 patients that are coming in, and then we'll hope for the best. I'll let you know how it turns out. I'm at school. Today's picture day, so we had to wear like a crew neck shirt, and then I'm wearing like can't even see, but I'm wearing dress pants. And then later one of my buddies from school is gonna be doing my makeup. I did get my eyebrows done on Monday, my first time, not too bad. And then one of my other friends is gonna do my hair. We're supposed to have it up in a bun, but it's a little crazy right now, but we'll see how it goes. And then first we'll have class from 8 to 12, and then from 12 to 2 will be pictures, and then at 3 o'clock we're taking a HESI exam for the boards to try to get ready for that, because the semester is starting to wrap up. But we'll see how that goes as well. I will see you guys in a little bit. This is the finished result. Ya nomás de ir a tomar las pictures and then we're done. Okay, I'm home now. This is the makeup at the end of the day. It held up pretty well, I would say. I'm really satisfied with how it came out. It looks pretty natural. I didn't want to do anything like too crazy, but time to take it off. I'm gonna learn how to do makeup, so that I could try to recreate this look. I ended up getting my passport photos today just because I wanted to. I was already all dolled up, so that was the plan. But I have to study for an exam that's coming up and start prepping for finals. It's coming up soon, but tomorrow I'll head over to the library to do a little bit of studying and I'll bring you guys along with me. So I'll see you guys in a little bit. Thanksgiving. Sorry I haven't been recording that much. It's been crazy this semester, but we just finished with the turkey. Ta-da! Yeah. So now we're just gonna get ready for church, and then leave that cooking while we go, and then come back, and then we can eat. Here's the final verdict. Ta-da! Delicious stuffing, potatoes, rice, salsas, macaroni, gravy, dessert, Jerusalem. Hope you guys have a wonderful Thanksgiving. See you al ratito morning. Look at how nice that looks, no? Okay, anyways, got to school early so that I could try and study for a little bit. I only have one quiz today. It's a week 15. And this quiz is going to be covering, let me see if the door's open, a chapter that was 70 pages long. So I read this chapter slowly throughout the Thanksgiving break. But we'll see how it goes. So I'm just gonna go into the study room, study for a little bit, and then head to class. So see you guys. Morning. It is Tuesday. So yesterday was Monday. Quiz for Perio went okay. I only got one wrong, which I'm a little sad about because I was like, should I change the answer? And I didn't. I should have. That's okay. So now I am on the way to school. I'm hoping to take a CIS, which is like an FMX, a full mouth series X-ray, to try to meet my radiology requirement. Okay, so this is like the last week of clinic, so I'm hoping to try to get a CIS to meet the requirement. We had to do 2 CIS, a bite wing, and 2 panels this semester, for this semester. And then I am also trying to complete a requirement for dentition charting, so that will be tomorrow, possibly maybe today in the afternoon, but we'll see. But I'm gonna start studying for finals. Finals will be next week. Next week, Monday, I have 2 finals for principals and for both classes for pain management. One is the lab and one is the lecture. Then Tuesday, I believe I have just perio, and then Wednesday will be the radiology and one more. I think that's it. That might be it. There might be one more. I don't remember, but yeah, the semester's coming to a close. This one by far the heaviest semester so far, just because we had to find that perio patient and do so much treatment planning. More often than not, I was up until like 3 a.m. trying to get that done for the next day, but I've been blessed by the Lord, so everything will work out just fine. So I will see you guys a little bit later. I'm gonna be heading over to the library to try and study. So see you guys later. Bye. Morning. It is Friday. So yesterday was the last day of perio clinic. So our patient ended up coming back for a 6-week evaluation, and we pretty much did everything from the beginning. So we did cursory IO, gingival description, BOP, furcation mobility recession, all that, and then did a cleaning. We were just trying to assess to see how his tissues were healing and if his pocket depths had reduced. And then they made it kind of like a fun little, I guess, like competition to see like which group had the greatest pocket depth reduction, and we ended up getting 5 millimeters, and it was a 5-way tie for first place, which was a first for them. And they ended up giving us 2 free instruments. So I ended up getting Gracie 1112 and 1314, which was pretty nice. And then afterwards, we turned in our final treatment plan. So we ended up with 103 pages, which was a lot. So we turned that in, and it took a while to copy and paste all the different treatment plans into one final one, but it's done. So now I just have to study for finals on Monday. I have perio final. No, on Monday it's going to be the final for principals at 10, and then at 12 we have 2 more for pain management lab and lecture. Then Tuesday we have perio, and then Wednesday we have the one for radiology. So I came to the library to use the whiteboard here so that I could just write out, try to recall everything from memory and see, like, try to fill in the gaps to where I'm struggling to remember certain things. And then I'll do that. It's 12 o'clock now, but library closes at 5, so I'll get about 5 hours of studying here, and then I might just go home, decompress, relax for a little bit, and then start the next set. So I will see you guys once I'm done. Alright, you guys, it is last week of school. I just finished taking, this is the second day of finals. I've been forgetting to record because it's been so hectic, but I woke up at 4:30 today to study for my perio final. It was hard. A lot of the stuff that I studied wasn't on there, but that's okay. But yesterday I took 2 finals. One for the lecture for anesthetics, and then principles, and then this one was for perio. Tomorrow we have a 4-question final for radiology. Should be okay. But right now I'm just gonna head home. I'll review just a little bit. It shouldn't be too difficult. Supposedly it's the same exam we got last semester for radiology, but I will see you guys tomorrow. School is officially over. Last final was taken yesterday for radiology, and it was just on what makes intraoral x-rays diagnostic versus like technique errors. Same thing with the panel. That was fun. Got that over with. It was 4 questions, but it did take a while because it was all written. And now we're heading over to a Christmas party, right, Jerusalem? Yeah. It is December 11th, but we're doing it early because one of our friends is leaving for vacation, so this is the perfect time to do it. We've got little gifts in the back. We did Secret Santa, and then we're gonna play this game where we all sit in like a circle, and then we throw like an item, and then we all have to kind of quickly like grab it, and you don't really know what you're grabbing because you're doing it quickly, so that should be fun. And we ended up doing like little boxes from Dollar Tree, ¿verdad, Jerusa? And then we put like lotion, face mask, hair clips, hair ties, and like a little chocolate. So it's like a little bit of everything. And then right now we're gonna head over to Costco to pick up some cheese pizza. Everybody's bringing a little something, so we decided to bring pizza. And then I'll see what else we can bring, maybe like cookies or something. We can get some galletitas, no?
Yeah, we could get croissants with like Nutella on the side.
We'd have to buy the big bottle. We'll see. So we all dressed up in matching pajamas, and these are all the little goodies that we got. Hello. It is Thursday? Is it Thursday?
Yes, it is. It's Friday.
It's Friday. So we got all of our results back for finals. I did pass all of them. Yay. Some of them were actually pretty hard, but all went well. What I'm doing now is registering for spring semester. So let me show you. So these are the classes that I'm gonna have. Nutrition for oral health is a new one. This wasn't there in the previous years. And then ethics, jurisprudence, and transition to professional practice. Community oral health. We're going to be doing a lot of volunteering. We already did a little bit of volunteering earlier in the semester. Dental hygiene principles 5, radiology 5, and clinic 4. And that's it. But I'm going to start studying for boards a little bit during break, not too much. And I still want to practice on my dentec, so I'll probably bring you guys along with me as I'm practicing and whatnot. But yeah, I've been blessed. All of my patients came in. None of them canceled to where I couldn't find anyone. I found 2 kid patients this semester. Now I just need 3 more to complete my requirements, and then Next semester, we're also going to start giving anesthesia on the patients. We'll have to do a couple skill assessments on those. So that should be fun. I've been learning. I did not do a good job of recording this semester. This one was by far the heaviest load because we had to do so much treatment planning with that perio patient. But I will see you guys later.